Today I'm joined by Chiza Westcarr, a dermal clinician and menopause wellness coach with a special interest in nutritional medicine. With a background in the skincare industry, Chiza's work led her to study human nutrition to better understand the why behind chronic skin conditions that left her clients without any confidence. Her passion for gut health also led her on a journey to using food as medicine, helping treat symptoms of the perimenopause and supporting women to embrace menopause with confidence. But how much does diet really impact our skin health? What foods can help manage symptoms of the perimenopause? And does fasting work? And how can you treat skin conditions like rosacea and acne through what you eat? Let's get into it. So welcome to the podcast. I know we've been trying to make this happen for a little while. I'm so excited to finally have you here. And thank you so much for traveling up to do this in person because they're always great conversations.
Yeah, well, thank you for having me, Shauna. I've been wanting to come on your podcast for ages. So
can you introduce yourself to our audience and tell them a little bit about your journey to get to this point and how you've ended up with this really special interest that you and I really share?
My name is Chiza Westcarr. I'm a dermal clinician. I'm a nutritional medicine practitioner, and I am a menopause coach. And it's been quite a convoluted journey. I did my dermal therapies just trying to better understand the inside-out connection. And when I didn't really find much in that, I then did a master's degree in human nutrition, thinking that I might learn about gut health, and there was nothing there. So I then did an advanced diploma in nutritional medicine, and that's where the gut really was positioned as the seat of good health, but also disease. And that's where my fascination with all things gut health started, because it affects skin health. I was working for a distribution company that distributed medical grade skincare in the industry, and I'd been with them for 11 years, but I decided to bail and finish my master's and then work in clinic, hands-on. So I started to see skin in all of its forms and see how it responded to skincare and to treatments, and it wasn't always uniform. So I knew that nutrition played a big role, so I was able to bring that into the conversation. But it was really when I moved into menopause myself, and my sister, who's a menopause doctor, asked me whether I was going to go on menopause hormone therapy, and I emphatically said no. When she explained to me all the changes that happened that I had no awareness of, from dementia risk to cardiovascular disease risk to osteoporosis, insulin resistance, weight gain, all of those things, I realized, okay, well, so I remember responding to her saying, when she asked me whether I'd go on it, I said no. And I was very, very emphatic. But as she explained all of these risks, I then said, in my defense, that if anything, I would go on to bioidentical hormones. And when she asked me why bioidentical hormones, I said, because they're natural. And she said, okay, so what are they? What do you understand as being natural? And I said, well, they're made from wild yam and soy. And she says, Chiza, but menopause hormone therapy is made from wild yam and soy. It is body identical. The difference between the two is that bioidentical hormones don't have the clinical research. They're not regulated. They're not standardized, whereas menopause hormone therapy is. So I jumped on board and I haven't looked back. So now my big thing is, as a menopause coach, I believe that women have to know that it is not just one little piece that we need to focus on. It's optimizing hormones, which we know, with estrogen especially, affects everybody's system. And so its decline is very widely felt, but it's also the exercise, it's the nutrition, it's the sleep, it's the managing of stress, it's all of the things. So all of those pieces come together. And so my mission is to educate women on that holistic approach and tell them about menopause hormone therapy so that they can then decide whether that's what they want to do or not. But I'm a passionate advocate of everybody thriving through this life stage.
So there's a few things I'd like to deep dive into there, if that's all right. So the first thing I wanted to note is that a lot of women, and you yourself, were hesitant. You were kind of defensive when your sister first mentioned it. You know, your first reaction was to say no, you weren't going to do hormones because that you felt that it wasn't natural. I'd love you to talk to that a little bit.
And I would love to talk about that a little bit. I've always been someone who has tried to manage any symptoms naturally. So that is with lifestyle modification. I'm not one to take Panadol for a headache. And so the idea of taking medication, which would have side effects, because all medication has side effects, was something that I didn't want to do. And I remember my sister saying, all you're doing is topping up hormones that have depleted. You can jump off if you don't want to at any point without there being any kind of adverse reaction. But I think for me, like with a lot of women, we had heard about that one study, the WHI study, Women's Health Initiative study, and the fact that there was a link to breast cancer. And so I didn't even know that it had been debunked. And so in my mind, HRT equals breast cancer. What has been amazing is having a sister who is a menopause doctor, because she really exponentially exploded my knowledge in this space and really sparked my curiosity to make me, take that deep dive. So I think that the fear is that hormones are going to drive breast cancer. Breast cancer is the one thing that stands out, I think, for a lot of women. So there's that fear around it.
It is interesting, isn't it, that that's probably the thing that women fear the most, and yet actually cardiovascular and heart disease is actually the number one killer. So it is very interesting. And of course, rightly so, we all should respect and want to make sure that we can, be breast screened and all that. But it is very interesting, the things that we fear versus the things that perhaps in reality are more of a risk. And I always think it's very interesting when you have a conversation with someone around hormones, that there is often a lot of fear and concern, but they don't have that same fear about, for example, drinking a bottle of wine. There's just not that fear about that. And yet it's very, very interesting because, replacing hormones that your body produced itself and were natural to that body and their body can break down versus something like alcohol. And yet there seems to be this complete disconnect there.
Absolutely. And I've got this big smile on my face because I see women like this who come in with quite exacerbated symptoms. And a lot of the symptoms are diet related, but also lifestyle related. And alcohol is a huge, huge part of their lives. And they justify it by saying that it helps me sleep, it helps me de-stress. But like you just said, alcohol is a class 1 carcinogen. There is a link between alcohol and breast cancer, but no one has educated the women about that. They're scared off of hormones, but then alcohol is something that is a big part of their lives. So yeah, that disconnect that you were talking about.
So let's talk a little bit about, I certainly see lots of women who are presenting with rosacea for the first time, but also people who've maybe had lifelong rosacea, or they've always had slightly red cheeks, but it gets worse at this perimenopausal period. And we see people presenting again with acne. We even see the eczema and the psoriasis, skins all seeming to flare at this time. And I believe our thinking is at this point that it's to do with reduction in that nice anti-inflammatory property of estrogen. But what else do we know is going on in the skin?
And absolutely, estrogen is an anti-inflammatory hormone. So you have that definite increase in oxidative stress, low-grade chronic inflammation. But I think it's also important to note that estrogen influences so much in the skin space. Estrogen is responsible for ceramide production in the epidermis, which helps with keeping that barrier function optimized.
Lots of women with terrible skin barriers at this time.
Absolutely. We talk about the skin microbiome. The skin microbiome shifts as the skin's pH shifts in this phase of life. So you've got this impaired barrier. But not only that, sebum production also declines. So you've got, when we think of the acid mantle that's made up of sebum and we say sweat, but then ceramide production depleting, you've got this open opportunity for these opportunistic bacteria to make their way into the skin. I think we also need to appreciate that estrogen affects vascularization, right? So when you think of all of these skin conditions that seem to flare up or worsen in the menopause, I think there are a few factors to consider, and that is the barrier impairment. I think it's a shift in the microbiome, as the skin's microbiome. I also think that the skin's vascularization changes, so nutrients and oxygen do not come up to the surface as well as they do in a younger skin. I also know that with the hormonal shifts as well, you've got the imbalance between testosterone and estrogen. you mentioned acne flares sort of popping up where they never had any issues with acne when they were young. So the hormonal shift, the changes in the hydrating factors, the barrier function, I think all of those contribute to some of the symptoms that we find. But then you have the diet component, you've got the stress component, cortisol. With estrogens decline, cortisol goes up, right? So even having that chronic low-grade inflammation can lead to the skin also becoming a lot more reactive during that time.
Absolutely. And add in not sleeping and being exhausted and probably not making as good choices because you're completely fatigued, and then maybe drinking some alcohol to try and make yourself go to sleep, and we're in a bit of a vicious circle.
And it is a vicious circle, and they don't know what to do.
The other group that I see are people who would describe themselves as having had quite resilient skin their whole lives, the kind of people who could walk into David Jones or Mecca or Sephora and, put a squirt of just about anything on their face and their face was fine. Suddenly now feeling that they're very skin sensitive to everything, that their skin's reacting to everything. Can you explain why that is a thing that we're seeing?
Yeah, well, I think it also comes back to what we've just talked about. I think at this phase of life, there are so many things that we can no longer do as women who are perimenopausal and menopausal, whether it be diet, whether it be lifestyle, even with product. There are people who don't really have a dedicated skincare regime. Like you said, they pop into a department store and they find something that's being talked about on TikTok and they're putting it on their faces. Fragrance can be a strong irritant, but also, most people think of scrubbing the lines and wrinkles away. And so using harsh exfoliating type products, which are a no-no because the barrier is impaired. So it's about, I think, education. I mean, we're very lucky that we work in the aesthetics industry and we have clients who come and seek our counsel, and we can put them on products that will repair the barrier, will support their skin, but also really optimize its health. So I think the issue with department store products is that they may not necessarily be right for, even though they might smell nice, the very thing that, draws you to the product may be what causes irritation in the skin with the high fragrance components. So what I always say with menopausal skin, you want to have the counsel or the advice of an expert to help you sort of navigate the changes that you're noticing.
Yeah, absolutely. I think it's interesting how people will just try things on their skin and their face particularly. And, it's nearly like they do little experiments on their skin as an organ that we probably wouldn't experiment on our other organs.
No, but I think TikTok and social media drive that too, right? Because everyone's trying stuff and people get swept up in that whole thing of, oh, well, that sounds interesting. Let me see what it does for me. Yeah.
I know you mentioned a little earlier the skin microbiome, and I know I want to talk a bit later about the gut microbiome, but the skin microbiome is definitely something that people have started talking about in the last couple of years.
Yes.
What can you explain to our listeners what actually is the skin microbiome?
Yes. And like you said, there's more of an awareness now about the gut microbiome, and you ask someone what they're taking supplement-wise, and they say a probiotic. They don't know what it does, but they know it's good for gut health. So the term gut health is thrown around. We now know, because there's a lot of research out to show that the skin has a colony of microorganisms, and they're microscopic, bacteria, fungus, viruses, that we wear like a cloak. And there's not a body part, when I say that's exposed to the environment, that does not have a colony of microbes that act as protection or a defense mechanism to keep us, our body area protected. And so the microbiome on the skin are these microorganisms that communicate with the skin has an immune system, communicates with the skin's immune system to keep it optimized. And so what their role is keeping the pH of the skin optimized and protecting it against invading possible bacteria and irritants. So we call the microbiome the first layer of defense. And so if it is optimized, then the skin glows and it's healthy and it's radiant. But depending on what's going on lifestyle-wise, what you're putting on your skin topically, you can disrupt the microbiome. And when it's disrupted, imbalance occurs, which means that you then have this opportunistic bacteria that can find their way into the skin and be associated with those conditions that we talked about before. So the skin's microbiome is a protective cloak made up of mainly bacteria that really protects the skin's function.
And what do you think about the use of topical treatments in, for example, a rosacea skin to try and reduce, so like the likes of ivermectin gel or Solantra, to sort of impact that microbiome? Are you a fan of that as a treatment?
I'll be honest with you, I don't use either of those. I find that keeping it very simple, introducing products that are ceramide rich, that are rich in hydrators such as aloe and hyaluronic acid, a nice barrier product that has ceramides in it, for me is the first port of call. When I think of sun protection, that's also something that needs to be considered. And then it's also looking at what treatments you can do in clinic to support that. So I've never used Solantra or ivermectin, and I have achieved great results just by keeping their routine at home very simple. And then in clinic, just starting off with very hydrating and nourishing types of treatments to start with to repair the barrier. And then introducing other modalities, such as, I'm thinking of one that stands out, which is laser genesis, which really works well for rosacea skin. So
love that. It's one of my favorite treatments.
And it just works a treat once they've had a course. So I tend to use good skincare and then in clinic modalities to manage my rosacea clients.
So if you had a perimenopausal patient who, maybe doesn't have a specific skin concern in terms of rosacea or anything like that, but they're just having dry, itchy skin, what would you recommend? Where would they begin?
Can I tell you a story?
You sure can.
A client of mine comes to mind, and I was just at a conference speaking about menopause, and I presented her as a case study. And she'd been coming to me for years, and we'd been just doing gentle types of treatments on her skin, hydrating and nourishing. And when I moved into the menopause space, I remembered her. So I contacted her and I asked her whether she was on menopause hormone therapy, whether she had considered it. And she said she had actually had a full hysterectomy and both of her ovaries had been removed, but they had not put her on HRT. And when she was coming to me, we would make progress, and then she'd ring me up and say, my skin's flaring, it's burning, and I couldn't work out what it was. But I had that aha moment when I moved into this menopause space. I sent her off to go and see a doctor who put her on menopause hormone therapy. Shauna, her skin completely it just went from being extremely reactive to settling. But then everything else about her did too. I then found out that she had had suicidal ideation and she had all these other things happening. So I think, and this is what I'm excited about, that when we as practitioners are looking to optimize skin health, we've got to look at optimizing the hormones, because estrogen affects all of the structures in the skin. So my approach now is I will always send them away to go and see a doctor. Now, it's their choice. I let them know why I'm recommending that they go and see a doctor about optimizing their hormones. And if they're interested, they will. And if they're not, that's okay. But they will always get better results if they do. So with this client, her skin is now a lot more settled. And she had reactive rosacea, which is now settled. So we've been doing a course of laser genesis. We also do skin needling, which her skin responds brilliant to. And she's on good home care. And her home care consists of hydrating serums. She's got a really rich, nourishing, ceramide-rich moisturizer. But she has vitamin A. And I think vitamin A is really, really important. But in her case, it's encapsulated. So it's a nice, gentle delivery. But I think when we think of what's going to change the skin, we know that vitamin A reverses DNA damage. So it really affects the cell at its core to start to repair and improve its function. And so vitamin A, she also has a serum that has peptides in it. So I guess what I'm saying is, in all of that, she doesn't have an exfoliant because vitamin A increases cell turnover, but it increases the production of healthy cells. And so it's a very, very simple routine. But we've got her skin to where it is just looking amazing. So in response to that question, it would be to start them off where they're at. If the skin is stinging and burning, that immediately tells you the barrier is impaired. So I start off very, very simply, making sure they're on a good sunscreen for one, that I usually tend to go for a physical. So something that is zinc-based, yeah. So I start off with a good sunscreen. I also check their cleanser, because a lot of women are using foaming cleansers, which with perimenopausal skin, not ideal. So we always give them a choice of an oil-based one or a cream-based one, which they will come back and go, oh my God, I love my cleanser. And then I'll do those two things and I'll put in a moisturizer and I just start them out with that. Come back in 2 to 3 weeks, the skin is very, very different. And then we look to see what else we can introduce. But it's always just starting off very, very simply. And usually because they've had such a history of reactive, stinging, burning skin, they're very wary of starting on new products. A lot of them are on Cetaphil, usually. And so it's really nice to see that gradual progression as the skin improves.
It's interesting, isn't it? I remember back to the days back in the UK whenever the WHI study came out, and we were all told that we had to get everyone off their HRT. So we had to phone all the patients and, call people in and cancel everyone's prescription. Like, let's not forget that, we went probably from rates in the 40% to rates of probably less than 2% of women. So like dramatic reduction. And obviously all those women had to have some type of consultation for their treatment to be stopped. And I think back to 2 women who absolutely just dug their heels in and absolutely refused to stop their hormones. And they were like, no, my quality of life is so horrendous. I'm not doing it, etc., etc. And I always think back to a time I visited home recently and I literally bumped into one of them, and she was actually now a lady in her 80s. And I came away and we actually had a bit of a laugh about it because she was saying, oh, my daughter told me that you're really into the menopause stuff. Do you remember you tried to get me to stop my hormones? I'm like, I'm so sorry. And she goes, but I refused. And she did refuse. But the thing that really struck me is, and of course it's an N=1, but she looked amazing. Her skin looked amazing. And there's a few patients that I have here who also refused to stop their hormones. And so they've taken them the whole time, again in their 70s and 80s.
Yes.
Their skin looks incredible.
Yes.
And I have to say, inversely, I've also had a few patients here who've come to see me who unfortunately have had either premature ovarian insufficiency, or they've had an oophorectomy and not being put on hormones due to miscommunications, lack of knowledge, etc., etc. And I have to say, their skin has not done so well. They have aged probably prematurely. So there is, the reality is, as both of us working in that aesthetic space, to be asking people to do various other treatments that will improve your collagen and your elastin. Everyone's obsessed by collagen banking.
Yes.
And it feels to me sort of unethical not to mention hormones.
Absolutely.
It's not for everyone. I'm not here to tell everyone they must take hormones or they should take hormones, but I'd love everyone to have the ability to have an educated conversation about it.
And I'm with you 100%. So I just recently spoke at the Fresh Life conference, which is a cosmetic nurses conference, and in the room was a plastic surgeon, and I was speaking on menopause, and same discussion. Nurses need to know about this because their patients are menopausal and perimenopausal. You need to know the skin is estrogen deficient. And he came up to me afterwards and he said, great talk. He said, as a surgeon, I know the difference between skin of someone who's on menopause hormone therapy and someone who isn't. The quality of skin is very different. The way it drapes is different. The way it heals is different. And so exactly to your point, if we know that we lose 30% of collagen in the first 5 years of menopause, and we know the changes that happen to the skin, it almost makes sense that should be where we start. And then we can look at the other things, the other modalities. And this is why I always say, menopause, no specialty owns menopause, right? So we're all working in our silos doing what we do. But I think what we're missing, or what we're not talking most about, is the impact of the decline in estrogen on the skin and just generally. And so like you said, Shauna, I think that if we talk about it more openly and if we tell people exactly what happens in menopause, then it's their choice to make. But a lot of women don't even know that these things occur because of this decline in hormones.
Yeah, for years it's been a bit of a taboo, hasn't it?
Yes, it has.
For many years in my GP rooms and with friends and family, I heard the same story. People feeling overwhelmed with a huge array of skincare products on the market. Fears around having sensitive skin, choosing the wrong product, are being sold something they don't need. There are so many people intrigued by the latest trends in anti-aging treatments, but unsure if that would be relevant or actually even help them. And many are feeling afraid of being left looking different, silly, or even having an adverse reaction. As a doctor of 25 years, and of course as a woman experiencing the signs of aging myself, I am proud to have created You by Dr. Shauna Watts clinics. Led by myself and an experienced team of doctors, our goal is not to change you, just help you become the most confident version of you. Every journey at our clinic begins with a comprehensive assessment by our doctors and includes photography, skin analysis, a thorough exploration of your medical history, and of course, time to chat about your concerns and desires. Together, we create a completely customized plan, helping you achieve the confidence that you've always wanted. We treat all skin concerns, including redness, acne, pigmentation, sun damage, and all signs of aging. We take a holistic approach and only include evidence-based therapies. So if you're ready to start prioritizing you and exploring what we can do to help, please book in for a no-pressure Planning Your Aesthetic Journey appointment. You will leave with a full written plan and information on any recommendations. Our clinics are based at Foresters Beach and Newcastle, and you can book online at youbydrshaunawatts.com.au.
So what I'd like to talk about a little bit now is another interest of yours, which is basically the gut microbiome and nutrition. So I wonder if we can do a little segue. I mean, it's still connected because we know that there is a change in the gut microbiome at this time as well.
There is.
So it's still all connected, but I'd love to ask if you mind if we kind of start to talk a little bit about that gut health. So first of all, what do we know changes in the gut microbiome? I know it's a very sort of evolving field, and I know there's lots of research, particularly in the UK, seem to be absolutely fabulous at this research. But what do we know about the gut microbiome generally, and then what do we know is happening in the peri and postmenopausal period?
So, and it's so good that we're now talking about the gut microbiome. And when we refer to that, we're talking once again about these tens of trillions of microorganisms, but the studies have mainly been done on bacteria because that tends to be the group of these bacteria that most impacts our health and drives disease. And we very loosely refer to them as beneficial or potentially, we call them good and bad, but it's beneficial or opportunistic. And they all live together, they cohabit mainly in the lower colon, but right through the gut, which is really the gastrointestinal tract that starts from the esophagus and ends at the back passage, we have got microorganisms, but the majority of them are found in the large colon. And they are very much affected by lifestyle, by medication, by stress levels, but most importantly by diet. And we know that the beneficial bacteria, in order for them to thrive, need fiber. And this is fiber that comes from fruit and vegetables. That's the best source of fiber because they break down this fiber to make these metabolites that we call short-chain fatty acids. And these short-chain fatty acids have a systemically anti-inflammatory effect. Keep the gut nice and non-inflamed, but also spill out via the bloodstream and affect, organs at, distant sites. When a diet is not high in fiber, unfortunately, their numbers deplete. But then you have this other group waiting in the wings, these opportunistic ones. If you're not eating fiber, if you're not eating fruit and veg, what are you eating? It tends to be ultra-processed food a lot of the times. And so for people who consume a diet that is highly processed, where there's not a lot of fiber, you are encouraging the growth of these other bacteria. And unfortunately, they drive inflammation. They produce these inflammatory molecules, which include lipopolysaccharides, that cause the gut lining to become leaky. Now, the gut lining is only one cell layer thick. And so as the little joins pull apart, you've got these inflammatory molecules that leave the gut, and via the bloodstream, we have associated them with dementia risk, with arthritis, with osteoporosis, with inflamed skin, right, with mood swings, etc. So the gut bacteria are important mainly because in the gut we have 70% of our immune cells living. And the gut bacteria educate our immune system. So if you've got the wrong ones in the majority, we now associate that with the rise in autoimmune conditions. So really, really important. Gut bacteria are also important for regulating hormones, for regulating bowel movement, for keeping weight down. So the gut bacteria play a very, very important role. Now, in menopause, lots of things change, including the makeup of the bacteria. So there's a big shift in the gut microbiome composition as well as diversity. Now, in order for us to be healthy, we need to have not only a nice, robust immune system, but we have got to have a diverse microbiota, which changes in menopause. So if we then are not eating foods that are rich in fiber, we start to notice that things start to change. You might have been someone who had always been able to control her weight, and now in menopause, that changes, because in menopause, our metabolism takes a dive. The gut bacteria that are responsible for helping to regulate our weight change. So weight gain happens, especially that central adiposity. Our sleep is affected. Moods change. And these are all linked to the health of the gut bacteria. There was a big study that came out 2 years ago on World Menopause Day in 2022 called the Zoe Predict study. Yes, and it showed all those things that with menopause, there's hypercholesterolemia, there's dyslipidemia, there's changes in sleep, all of the things that we know happen that menopausal women complain of. This study showed, largest nutritional study of its kind, a collaboration between King's College London and T.H. Chan School of Public Health and University of Massachusetts were involved in this study. And their point was menopausal women can no longer eat diets that are ultra-processed because the body cannot process it anymore. Without you changing your diet, you now have insulin resistance occur as a result of moving into this life phase. So there are some really dramatic changes that have to happen. When you talked about cardiovascular disease being the number one killer, cholesterol levels increase without you changing your diet.
The number of women who are so upset and frustrated by that when I, check their bloods and people, understandably, they feel defensive. Yes. They're like, but I've always had a cholesterol of 4. I don't understand. I'm not doing anything differently. The number of women who come in to see me in tears because they're people who probably have controlled their weight their whole life. And they're like, I am not eating anything differently. These women are sometimes going actually to the gym way too much because they are trying so hard and they just do not understand what is going wrong.
Which makes inflammation worse.
Yeah, and of course, we're just in this vicious circle. So the whole weight thing's very interesting. I did read a couple of I love that group, Zoe. I love that podcast. Anyone listening, it's a great podcast on nutrition.
Yes.
But I read an interesting study that they, in really simple terms, they took some gut microbiome secretions from some people who had obesity and they transferred them. It was a mice study, and they didn't change the amount of food that the mice were allowed to have. And within, I think, 6 weeks, the mice who had this changed gut microbiome were all overweight, despite still only having access to the same food.
Which points to the fact that he has these obesogenic bacteria.
Yeah, absolutely. And I think, it's very interesting, but I think for years, people have been made to feel bad about not being able to control their weight, or being made to feel guilty, or made to feel that they're lazy or they don't have enough motivation. But I think we're going to look back in 10 or 15 years and realize that we've had a very oversimplified idea around obesity and weight. And I think that it is much more complicated than actually we believe.
Absolutely.
If it was so easy,
why is it so hard?
Why is it so hard, really?
And even the talk, did you attend the talk on the last day of the World Menopause Congress? When Deakin, I can't remember his name, Deakin University researcher was talking about obesity and how it's nobody's fault. You've got obviously that genetic component, but he was saying that we still don't know. No.
Well, I think the really interesting thing for me on obesity is the introduction of the GLP-1 drugs. I think what's really interesting, so that's the Ozempics, the Wegovys, the Mounjaros, all of those. And, again, for years, I think we've made people feel really guilty that only if they could just try a little harder to lose weight, or if only they could be a bit more motivated, they would lose weight. But whenever we inject people with a GLP-1, we're not injecting them with motivation. We're not injecting them with willpower, and yet people lose phenomenal amounts of weight. And so I just think it's so time for everyone to stop laying on the guilt on people.
And stop the blaming, stop the judgment, I think. Yeah. I'm actually in February, I start a PhD looking at the effects of personalized nutrition, exercise and coaching on the cardiometabolic health of postmenopausal women. That's in Feb I start.
That's amazing.
And I'm doing it because, for this same reason, women are struggling to work out how to get their weight under control. Yes, you've got all of these new drugs that have come out, and they're miracle workers, but they're not for everybody. And there are some side effects from them that need to be considered. But personalized nutrition is a passion of mine, because no two people are the same. And so to say to someone, you've got to calorie restrict, it doesn't work. But if you look at a group of blood values, including C-reactive protein, looking at your liver enzymes, etc., there's actually a company in Germany we send the blood results to, and they come back with a food list, just a list of food that is individualized to each person. And they follow this list of foods, make their 3 meals. There is some time restriction in between, and their health profile changes. And we don't focus on weight. We focus on getting you healthy, optimizing your health, getting your markers back into balance, back into range. And the weight will fall off, but that's not the focus. And so I think that's the sort of thing that we need to see more research in, which is why I'm doing this PhD, because we have wonderful results. I don't believe anyone can lose weight if you calorie restrict, but it's about keeping it off, but also doing it in a healthy way. Because with that calorie restriction, if they say 1,200 calories, you can make up, that 1,200 from sugary foods if you choose to.
Yeah, absolutely.
Whereas it really needs to be focused on gut supportive foods, lots of fiber, a bit of fruit, healthy fat, good sources of protein. So yes, I'm also, just with the GLP-1 inhibitors, I don't want it to be a quick fix, that people sort of don't make those changes that need to be made with the relationship with food, and understanding that food really is fuel.
Yeah, absolutely. Actually, on that point, I had a patient who I saw about a week ago who is on one of these injections, and she was telling me how she was just drinking lots of Coke Zero.
Yeah.
And I wondered what your thoughts were on those 0-calorie drinks.
I'm not a fan. I would rather you just drink water, or that you my big thing is to try and get people away from processed foods that are empty calories and don't really do anything. They provide no benefit. I shared with you something that I'd produced, and that was a beverage that tastes amazing, that they can have in sparkling water. I think giving a client something that they can replace their alcoholic beverage with, or their Coke Zero with, that is of benefit, gut supportive, maybe that has ingredients that are going to help with stress modulation, etc., is a better way to go than something like Coke Zero that is, it has no benefit. I'm not a fan, personally.
Yeah, I think it's really challenging. I think it's quite addictive. I think people find it really addictive. They find it hard to stop drinking. And I think the other thing is there is some interesting research that tells you, even though in theory it's 0 calories, it actually completely changes your metabolism for probably the next 36 hours, and even shown that you make different food decisions.
Yeah. But I think that's also where counselling comes in, because you have to meet a person where they're at. But I also think it's about providing them with options too. And with the 0-calorie drinks and the fast food, that may be all a person has ever really consumed. And so bringing in healthy food. And I have a policy as a nutritionist of what I call the crowding out theory. And the crowding out theory is, let's get you eating some good healthy stuff. And if you're still hungry, then we'll look at you adding in that thing. But mostly because we're introducing foods that are satiating, we've got the healthy fat and the proteins and the fiber in the vegetables, they're not hungry. But it also means that they can go from breakfast and not snack because they've got the protein and the healthy fats in. And so they just find that, oh, I didn't even miss it. And then as the gut bacteria changes, your cravings change. So it's about getting them started on that journey, but saying, okay, let's keep it there. If you need it after you've had your meal, then, you can have it. And they invariably don't. And it doesn't take long then for the gut bacteria to change, for you then to start to crave foods that are healthy. Because when you are in that cycle of eating highly processed foods, it's all you crave. But once we change the composition of your gut microbiome by changing the foods you're providing to it, it's not long before you start to crave foods that are healthy and whole foods based.
What do you think about the ability to use foods that promote hormone health?
So when you talk about foods that promote hormone health, I'm thinking of menopausal women who are usually struggling because they have elevated cortisol levels. They have insulin resistance. So even if we talk about those two things, so I mentioned before that as hormones shift, women start to notice that they're putting on weight because their body is not able to process sugar the same way. And when we talk about sugar, it's not just added sugar. It's those processed foods. It's the biscuits, it's the bread, it's the pasta, and all those foods that cause your blood glucose levels to spike. In response to a blood glucose spike, the pancreas releases insulin. Insulin, we call the blood sugar regulating hormone. It pushes that glucose into the cells, mainly muscle, liver, but the cells around the body will take that glucose and use it for energy. But it's really important for insulin to communicate with the cells that a sugar dump is coming, and for the cells to then open up and take the sugar in. But if the diet is highly processed, for example, you have a very sugary, carb-heavy breakfast, you're then hungry by morning tea and you have a muffin, and then you have sushi, which is rice-based for lunch, and then you have afternoon tea, which is a biscuit, and then dinner is chips because you're so hungry before you have your main meal. You have this constant insulin spike. And what happens in perimenopause and menopause, unfortunately, is with the change in metabolism, etc., you'll find that your blood glucose levels remain elevated. The pancreas pushes out more insulin to try and bring it down. So you now have hyperinsulinemia and hyperglycemia, which is that metabolic syndrome in the making. And so what we really need to do is to try and find ways, first of all, to bring down that risk of insulin resistance, which we know is going to lead to type 2 diabetes. So it's got to be with food. And the kinds of foods that we're talking about are foods that are non-insulinogenic. So foods that are non-insulinogenic would be protein in the right amounts. And we know that menopausal women are not eating enough protein. Fiber is also going to regulate insulin, but keep you feeling full. And then fat. We still have a phobia around fat. People will still choose to go fat-free because they think it's better for them. But when you look at what the ingredient is that's taken the place of fat, it's sugar, right? So it's really... It's about education. We're talking about menopause and education. This applies here too. I will say to my clients, having a breakfast with, as an example, egg and avocado, protein and fat will keep you feeling full until lunchtime. You won't need to snack. The idea of someone going from breakfast to lunch without a snack, for a lot of people, they can't even comprehend it because we've become such a snacking kind of society. But if you had a breakfast, even a chia pudding, which is full of fiber and healthy fats, that'll keep you satiated. So the idea is to try and not have those crazy insulin spikes. So that's one hormone that we can absolutely control just by changing the composition of what we eat. Another one, when I think of stress, as estrogen declines, cortisol goes up. There is not one perimenopausal woman or menopausal woman that is not dealing with the impact of stress in whatever form, whether it comes out as this crazy rage that she feels, not being able to sleep, feeling very anxious. And then there are habits. We as Aussies, we love a coffee. People, they cannot not have a coffee, but coffee will spike cortisol. right? So
I'm a weirdo. I don't like coffee.
Well, I don't drink coffee, but there are women who cannot not have a coffee.
Yeah, no, most people love coffee.
Yeah, so I guess it's just looking, as an example. So I'm thinking of, first of all, just if you are someone who has a breakfast that is really carb based, that you look at other options, which would include things that are protein, healthy fat, and fiber filled. And that's across the board, really.
Yeah, it's amazing. And what do you think of this trend towards the carnivore diet? I've had a few patients come in. I just cannot see how it could possibly be good for you.
I remember going head to head with the carnivore girl, she calls herself, or the grass-fed girl, she calls herself on Instagram. I went into her DMs and I said, you are highly irresponsible for promoting what you're promoting. Because people follow you. How can this be good? What about the gut bacteria and all of this? And what she came back with really made me sit up and think. And she actually said, I cannot eat vegetables. I have reactions to eating vegetables. So I started to do some research, and there are certain vegetables can contain lectins and plant poisons. They refer to them as. Nuts and seeds do as well, which is why you soak your nuts and seeds. But there are some people that are quite intolerant of certain plants, and they have found that a lot of their symptoms have gotten better when they've removed them from the diet. So they've gone completely carnivore, and a lot of their autoimmune conditions seem to have gotten better. This is where I go back to what I said before, which is the concept of bio-individuality. No two people are the same. I find that I can't do keto. Keto does not work for me, right? But it works for some people. So I think that even though my mind as a nutritionist who is big on gut health and the bacteria and their need for fiber, I can't understand these little outlying groups that seem to thrive on it. I don't know, there are no studies long term to say what the effects are going to be, but there seem to be people who have gotten a whole lot of health issues under control by going carnivore. So I'm kind of on the fence. I guess what I'm saying is, as a nutritionist, I would never recommend it, but I also recognize that there are people that are doing it and they seem to be thriving. And I say, hey, if it works for you.
You wonder how they would not have vitamin deficiency, so that's a bit I don't understand.
But also how their bowels will be regulated and how your gut health remains optimized. That bit I don't know. And this one of the ladies, she's a naturopath, and she put her results, did a blood test, and everything was in range, including her inflammatory markers.
Well, interesting.
Very.
I think we're more diverse than we realize.
I think so, and that's really my take on it.
So, what about fasting, and particularly in this age group? Mm-hmm. So, I have lots of women who come in and tell me they're doing 16-8. Not seeing a lot of people losing much weight doing that, interestingly, but I mean, I was a big fan of Michael Mosley. All right, I absolutely loved that man.
Devastated.
But I just wonder what your thoughts were on using fasting in this age group.
In my experience, I find that whereas fasting may have worked in the younger years, in menopause, things seem to change and people don't do as well with fasting. Now, once again, it's a very individual thing. I have some clients who swear by fasting. My big thing here is we know that fasting is great for autophagy and helping with the whole detoxification. With menopause, we are already struggling to get our protein intake in. So if you're fasting, you're only restricting your eating to 2 meals a day, you are going to be protein deficient, right? We're wanting to try and get as much protein in as possible. You then need to question the reason for fasting. And for a lot of them, it's to try and lose weight. What you'll tend to find is the fasting means that by the time it gets to lunchtime, they are ravenous. So they tend to eat a lot more than they would have had they had 3 meals a day. So a lot of my patients or clients, when they come in who are fasting and I say, we're going to get you having breakfast, lunch and dinner, there's usually pushback because they think it's going to make them put on weight. It actually doesn't. But what they will find is that it controls their blood sugar levels a lot better. And they're able to just completely have their cravings removed. So what I find is that for most women, in this age group, it doesn't work as well as it did when they were younger.
I'm seeing lots of TikToks and Instagram reels and sort of very jokey sort of videos about women saying that eating protein has now become their full-time job because they don't have time to consume all this protein that they're meant to be eating. So it has become a bit tongue-in-cheek that peri and postmenopausal women need to eat a lot of protein. Why are we needing to eat a bit more protein?
The reason is because of sarcopenia. So one of the things that happen in menopause with estrogen decline is muscle mass decline. And muscle is so important for a number of reasons. One, it keeps us upright. It keeps us balanced. We start to lose muscle as we move into this time, and we start to notice that insulin resistance is actually connected to muscle health. Muscle is the biggest reservoir for glucose intake. And if we are not using our muscle, we actually will find that the body's ability to utilize that sugar lessens. And so we have that risk of hyperinsulinemia. When I think of muscle, the more toned we are and the more muscle we have, the better bone health we have, because there's that direct connection as well. I think of muscle, and I'm smiling now because one area that we haven't talked about that needs to be talked about is pelvic floor health, and the muscle that keeps our vaginal anal structures sort of intact and healthy. Prolapse of the uterus is a very, very big problem in menopause. Urinary incontinence, urge incontinence, stress incontinence. We don't talk about those things, but most women will end up with incontinence of some form. And if we had healthy muscle, then we would have fewer of those problems. So to go back to your question, we need to eat protein because in order to optimize muscle mass, we need protein. So that in itself is a big thing. So with the decline in estrogen, we lose muscle. And so we lose support. We can fall. If we fall and break a hip, it can lead to death. So it's important also for grip. Grip strength goes as we age. So when we think about, when you're young and you're not really at that age, you don't really give it much thought. But when you get to those later years and you have a fall and you can't get yourself up off the floor because you don't have muscle tone, it impacts us more than we realize.
Oh, absolutely. I think the two things, if you think about why people do end up in permanent nursing care, if you look at women, one of the primary causes is urinary incontinence and recurrent urinary tract infection. So you're incontinent, and the second thing is that loss of muscle. And I always think of people who say, look, you want to have really strong thigh muscles because thigh muscles allow you to get up and down off the toilet. They allow you to get in and out of the chair. They allow you to get up and down and answer your door. They allow you to get off the floor if you fall. And once you don't have those abilities, then you also find yourself in a nursing home. And so, urinary incontinence and actually muscle strength are really paramount. And yet it's probably not something that's really explained at all. And so in terms of protein, I did read something recently as well that we tend to protein, load our evening meal, and a lot of us don't eat a lot of protein sort of at breakfast and lunch. And I did read that actually it probably is really important that protein is actually divided throughout the day. How much is the right amount in this age? What are we aiming for?
In this age, between 1.2 to 1.8 grams of protein per kilo of body weight. So that comes to around, say, the 80 to 100 grams of protein spread across the 3 meals. Having it in one meal, the body's not going to be able to utilize all of that.
And actually, I know the answer to this, but I'm going to get you to answer. A patient asked me the other day when I was saying this to her, she said, so is it 1.2 grams per kilogram of the weight I want to be or the weight that I am now?
The weight that you are now. Yeah, because who knows who? Yeah, it's the weight that you are now.
Yeah.
For your body to utilize that.
Yeah, absolutely. Okay. So one other thing I wanted to talk about is foods to give you glowy skin. Are there foods that we know do that?
Yeah, there are. Fat. Fat's a good one. So when you think of fat, think of nuts and seeds. Think of oily fish. I think of foods that are rich in hydration as well, because hydration will make your skin glow. So if I think of a few, cucumber is one, watermelon. So just anything that is very hydration dense. But I think more important than that, I think of the cell membrane that requires your omega-3s, for example. So you need your omegas for your cell membrane health. And I think the way your cell membranes are nice and healthy, that also translates to cells that are plump and cells that are really working optimally. So if you can try and add in, I think, flax seeds, chia seeds, I think Brazil nuts, macadamia, nuts that are rich in oil, and then your oily fish as a starting point. I know that not everybody is an omnivore. So avocado is a great one. Olive oil is a great one. I think the first thing is for people to stop being so scared of fat and know that fat does not spike insulin at all. So you're not going to get fat from fat for healthy kinds of fat. Usually the problematic fat, your trans fats, tend to be associated with those processed foods. So your fried chips and your fried, your all your processed foods, those are not so great. But I always think a Mediterranean diet is always, every year it wins. If you look at the best diet in the world, it's always Mediterranean.
But it's not spaghetti bolognese.
No, it's not the pasta. It's more the veggies and the oily fish. Yeah.
What are your thoughts on? I had quite a few patients recently who are not diabetic trying out these continuous glucose monitors. Yeah. Do you have any thoughts on that? I think it's quite interesting because I think it's made people a little bit more aware of what they are eating. I had one patient interestingly telling me that, one very healthy vegetable was actually seemed to spike her her glucose level in, it was a carrot, raw carrots.
Yes.
She's absolutely loves raw carrots.
Wow, I can tell you why.
Oh, go on.
Yeah, because we actually talk about above the ground and below the ground veg. Below the ground veg are very carb dense, and carrots are quite high in sugar when you look at it.
Well, they are quite sweet.
They are. And all of our favorite veg are below the ground. The turnips and the beetroots and all of those, right? We're not so interested. When you're ravenously hungry, you're not going to go. You'd rather go for something that has a bit of carbs in it, just because it gives you that feeling of comfort, perhaps. So you're above the ground are more water based, and they have less sugar in them. So think of your lettuce and your mixed leaves and your cucumber. They're all above ground. So the below the ground ones would cause the spike. I mean, they're still better than having a cream bun or a donut. But when you make that comparison,
she was shocked. Like her glucose was going really quite high with raw carrots, which I thought was definitely very interesting. But have you had any patients trying out?
No, and I was actually curious to try it out because I wanted to see what food spiked.
Oh, I'm going to do it. We should do it.
We should. Let's do it. Compare notes.
Yeah, absolutely. And in terms of, I'm very interested. I'm in a group called Doctors for Nutrition. I'm really interested in, using food to treat things like rosacea. Do you have any thoughts on that?
Yeah. So basically it comes back to, and I've had some great results using food as medicine. And it comes back, I think the first thing we need to do is to really support the gut lining and stop the leak. That's the first thing. We then need to optimize the good bacteria. We know that there's communication that happens. We talk about the gut-skin connection. So inflamed, whenever I see rosacea, I know that your gut health is not optimized. So I always start with gut health and I get the diet really cleaned up. And a lot of times you can't, and this is why you can't look at something in isolation. You can't go, oh, you've got red skin, I'm going to use cilantro or whatever it is. You've got to delve a bit more. And so by getting them onto a diet that is whole foods based, with the oily fish and the healthy fats, and we get rid of those inflammatory foods, that's a start. And even doing that with home care for the first 2 weeks, they come back, you're amazed, they're amazed, but they're also feeling better. So it's about looking at foods that are non-inflammatory and foods that are going to dial down inflammation, but also support skin function. So oily fish, nuts and seeds, the same kinds of things I was saying before, healthy, well-sourced protein, those sorts of foods. I never ever introduce a probiotic before I clean up the diet, because the way that I see it, you're trying to take a probiotic to fix things, but at the core, you've got inflammation drivers. So we clean them up first. So I always go clean the diet up, get them on good skincare. Alcohol, we need to find a substitute for that because that's a big one. I had an Irish lady in with very bad psoriasis, and I always check her diet. Diet very processed, but alcohol. And she said to me, I've been drinking since I was 14. So I'm not about to give up the alcohol. So I had to find an alternative, which we did. And we got it under control. But it's about making those changes, but they have to be willing to. So it's education and explaining that connection.
And what about teenagers with acne? What can we do with their diet?
So, and I also have teenagers with that. I have this one who comes to mind. Mum came with her. Oh, no, her diet's very good. No, I cook. And so after doing the consult, I said, Mum, okay, so this is not for you to contribute to. We're asking your daughter. And I asked her what happens when she's not eating Mum's food. And of course, she's eating all the things, all the sugary foods, etc. So I create meal plans. So I give all of my clients, I've got skin condition focused meal plans. So every client gets a meal plan. And they do that for 2 weeks. And Mum loved that because Mum's cooking the food, and we got the daughter to commit because she hates the fact that her skin's so bad, which has lessened her confidence. And so I find that removing sugar, which is going to spike insulin like growth factor 1, which is going to then be associated with this increase in acne. I find that getting them off the sugar, getting them off cow's milk is a big one in all its forms, right? So just finding the foods that they're eating and identifying, but explaining to them why we're making them make these changes. And then they start to see a big difference. And it's amazing psychologically how that then, with that confidence boost, how they're compliant going forward. So yes, diet is a big one, and then good skincare.
And anything different in the approach to acne in an older adult?
In an older adult, well, you also want to make sure that the diet is optimized, which, like you said, when there's stress, you tend to go to comfort foods. So it's cleaning up the diet there. It's using, and sometimes with skin that's very barrier impaired, you can't use harsh acids on that skin. So it's about repairing barrier function. There are some products that have ingredients that will definitely help to regulate that microbiome, which makes a big difference. So depending on what the diet's like, I will make adjustments as and where it's needed. I have not yet found a person who has a very clean diet using good skincare who has the same kind of responses as someone whose diet is not optimized or cannot do with some improvement.
Okay, amazing. I'm nearly finished. You'll be delighted to know.
I just love this.
I just have I have 2 more questions, but one more, which is, what are the few things that you would wish that people knew about their skin and the connection with what they eat?
That it's not a sacrifice to make the changes that are needed to get your skin looking amazing. I wish there was more education in this area, because we know that nutrition, there are so many opinions and people are very confused as to what to do. I think that if we think about gut health as the starting point for glowing skin, and you eat to feed your good bacteria, your skin will thank you.
Yeah, absolutely. So I ask everyone who comes on the podcast one final question, which is, if you could talk to your 20-something self, what would you tell her?
Oh my gosh. My 20-something self was so anxiety-riddled and so lacking in confidence and so judgmental of herself. And I would say to her that everybody has imperfections, and they're not to burden you. I think that they're to be celebrated. My little niece is 17 and she spends so much time in the mirror. And I say, honey, no one's looking at you. You're gorgeous. No one's looking at you. Everybody is so self-absorbed. No one really cares. And so we spend so much time worrying about what other people think.
But they're not even
noticing. So just spend more time just learning to laugh and be happy and celebrate whatever those imperfections are that kept you housebound, kept you running back home when you caught sight of yourself in a shop window to change. So much time is wasted worrying about what other people think. And I just think you've just got so much ahead of you. And just celebrate your differences and don't let them burden you.
Amazing. Thank you so much. You've been so generous with your knowledge. It's been amazing talking to you.
When I started this podcast back in December 23, I knew that I was lucky enough to have amazing conversations with various health professionals across all facets of medicine and allied health. And I knew that you would probably really enjoy being a fly on the wall to hear what we talked about. And that's how the podcast was born. And what you probably don't know is that this is a bit of a passion project. We don't have any sponsors or funding. And without your help, we won't be able to continue bringing you these great guests. So if you can please spread the word about the podcast, share it with someone who you think might benefit from the conversation that you've just listened to, or if you can leave us a review or a comment, it would mean the absolute world, because that actually helps the podcast spread further and get more people to hear our message and hopefully allow us to invite bigger and bigger guests onto the show. And I would so appreciate you helping me back. Thank you. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.